So what are the other alternate donor areas apart from the posterior part of the hair which are used for hair transplant surgery? Hi, I am Dr. Arun Panda. I am a facial plastic and hair restoration surgeon. Very often we are asked, like, if I do not have adequate amount of donor grafts on the back of my head, what are the other areas wherein we can take the grafts from? So one of the very important areas which are considered as donor for the hair transplant surgery is the beard area. In this video I am going to show you how we harvest the beard grafts. So this is the area of beard which we normally outline, from which we are going to take the grafts from. So the advantage of these grafts are they are very thick, they give very good density, and they do not fall over a period of time as they are resistant to testosterone or androgens of 5-PhD. So this is a very good graft which can be taken, and it can be placed on the recipient area. So this area of the upper part of the neck is actually supplied by transverse cervical nerve from the C2 and C3, and this is a very sensitive area. So what we do is, before we harvest the graft from here, we have to anesthetize the whole thing. So what we actually do is we give local anesthesia with 31 gauge needles all around. So this actually blocks the nerves at the peripheries. So once it is all anesthetized, the patient is all numb, now we are all set for taking the grafts, punching the grafts in a similar fashion. So now, the problem with the beard is, so you got to extend the neck of the patient, because that's important, because once stretched, we are able to access those areas. And then what we have to do is, we have to start punching the grafts. Let's start from here. The punching again happens in a similar fashion how we do for the back part of the scalp. We have to be very cautious here because the thickness of the grafts, they are much thicker here. Okay, so once we are done, we start extracting single. So as you can see, this graft, so we have got the root bulb here, and there's the graft. It's a little bit of a fat all around there. Again the roots. Again the roots. So this is very important when we are extracting the In a similar fashion, we would be extracting about 600 or 700 grafts from the beard area, and these are going to be implanted in the area, in the recipient area. So the advantage is these grafts are very thick, if you can see, much thicker than the occipital area, and they give a good density with the bulb. That's very important. So that is how we do the beard harvesting. That's how we do the beard harvesting for hair transplant surgery. If you have any queries, you're most welcome to let us know. We will be more than happy to help you out with any facial plastic and hair restoration procedures. Thank you. Thanks for watching.